My name is Veronica Nemachena. I'm the Chief Executive Officer for Midlands AIDS Service Organisation, in short MASO. We are based in Kweru, covering the Midlands province. I'll be speaking on behalf of MASO and the health sector and the NANGO Midlands chapter. The Covid-19 pandemic posed quite a number of challenges within the health sector. And as a result of Covid-19 coming in, nobody was prepared for Covid-19. And as we all know, we woke up to some Covid-19 regulations and restrictions, which also put organizations into a situation where we started to plan what to do without proper consultations or sitting down. But it was a question of ensuring that we continue to operate, we continue to meet our stakeholders as well as our beneficiaries in the communities. Our operations have been affected since March 2020 by COVID-19. Firstly, we were disrupted in terms of activities. We had to cut off all activities, face-to-face interventions, which was very difficult for most of our organizations in the health sector, because most of our work rely on meeting the beneficiaries, getting to where the communities are. So most community-based organizations faced that challenge. Yes, there was talk of working from home, operating from home, which was also quite difficult because our communities, you can't access them online. Secondly, we couldn't even start knowing how to communicate. Today, it's much easier now because we now have Zoom meetings, we have online meetings, but I'm just reflecting back in 2020 when the COVID-19 lockdown was announced and we had to start saying, what do we do? But as a sector, we also realized that most of the communities could not also get their supplies, the essential supplies of medication. We talk of the chronic illnesses because most stocks were ASP when the lockdown was announced. And these were some of the issues we began to collect from the communities, that people could no longer access their usual medications. And what we're beginning to hear from the communities, that certain people who could get some medications were now selling it very expensive, and which was also quite out of reach for most of the communities. In terms of supplies that include food, that was also a big challenge. We were already running a project in emergency and got supplies up to March, but it needed to continue. And hence those essential commodities needed to get to the communities. However, having realized those challenges where we're having limited access to medication, limited access to services, and limited access to essential commodities being the biggest challenge, as a sector, we began to think of how best to maneuver our way to get to the communities. Our biggest worry was that the communities themselves did not understand what COVID was all about. Hence, we needed to go out to explain about COVID, raise awareness, and ensure that they also prevent infection from COVID-19. And so we began to look for letters of operation, and our district development coordinator helped us in providing letters to access the communities. And our biggest worry and focus was to ensure that the communities also have food. And most of the organizations that are working in the health sector had also to rush with information to the field around COVID-19, flyers, and essential information. Secondly, food was the biggest challenge because 2020 was a year of drought. And so we had to organize to ensure that the commodities which were essential, like food, and especially targeting the most vulnerable, would get to the communities. We also were working to ensure that even in terms of ARVs, the communities had to get the essential medications. But however, these were not adequate, the arrangements that we made, and as we got feedback from the communities, most of them had also challenges in getting their essential medications. When we come to the major challenges that we faced during COVID-19 as a sector, was lack of coordination. We already coordinated in our various activities, but when COVID really hit, there was no proper coordination. And what I was been talking about, each one was trying to get letters, each one was trying to get commodities to the communities, but it was not in a coordinated manner. And hence, it was more like an emergency, the way everything was actually operating. And so that was the biggest challenge. Then the other challenge was also being able to be meeting online, because again, like I said earlier on, getting Zoom and being able to be online was something that had not yet been developed. And even to think of how do we then meet the communities online was also a big challenge. However, after some time, we realized that we could actually send commodities like sanitizers. We could help communities make masks. We could also distribute masks to communities. And we were also able to meet the communities after giving them information about COVID and ensuring that they observe social distance. That was very critical, because without that, there was no way we were going to meet the communities. So we started teaching the communities that we need fewer people on the ground, and we need to meet people with the recommended social distancing. And we even supplied sanitizers. We supplied buckets with running water, with soap, so that each time we would meet and give them awareness on COVID-19, they would wash their hands, practice social distancing, and continue to put on their masks. When it came to distribution, we also ensured that they maintained the social distance and they come in numbers. And this is how we managed to go around issues of COVID-19 in 2020. When it came to 2021, the first lockdown again did disrupt our interventions. But now, because we had some strategies that we had taken on board earlier in 2021, we were a bit more prepared, and we had already put measures in communities in terms of monitoring, where I would say the community structures that are on the ground continue to give us feedback through text messages, through WhatsApp. And so having put together that kind of structures where we continue to get information, continue to get what is on the ground, even including flooding during the beginning of the year, those structures were very useful. It was possible because we could send them airtime and they could give us now feedback. So this strategy of now organizing the communities structures to give us feedback was now beginning to yield the results, which was different from 2020, which just came without us being prepared. And I would want to say, as a sector, we've managed to ensure that our communities are aware of COVID-19 and practice the necessary conditions to ensure that we do not spread COVID-19. And as a sector, we have already made sure that we continuously interact with other service providers to ensure that the services continue to reach the people even during COVID-19, and that people shouldn't be cut off from supplies of medication, cut off from essential food commodities, and cut off from essential information, because we have now come up with strategies of ensuring that we remain safe and keep safe though we continue to interact with our communities even during COVID-19. I would also want to say the recommendations that I would want to put to NANGO is that let's continue focusing on coordinating the sector during such times of COVID-19, so that as we go out as a sector, we are more coordinated, we have the same messages to communities, we use similar strategies, though being different organizations, but let's continue to have agreed strategies of reaching out to communities. And let's continue to work hand in hand with the Ministry of Health and Child Care, who are also spearheading the control of COVID-19, that all the organizations within the sector strictly adhere to the requirements of Ministry of Health, and which keeps the nation safe. With other development partners, let's continue to work together. COVID-19 is real, and instead of going out there and outdoing each other, let's go out there and coordinate and ensure that the communities benefit. Then I would also want to say to all the other agencies out there, even donor partners, they need to continue having funds for COVID-19. Some donor partners are giving us specific funds for COVID-19, which helps us to ensure that all the necessary measures are put in place that ensure that the information around COVID-19 is shared right down to the grassroots, ensuring that nobody is cut off from essential supplies, which we felt that during COVID-19, these had the major effects on our communities and on their operations. And to just mention also before I wind up that the urban sector was hard hit in that all the shops were closed, and some of the community members who are in the urban sector could not continue to run their usual markets because they are within the informal sector and they could not get the usual income they were expecting. And so we need also to plan for that even before we have another wave, to say what should they be doing in order to survive. Because again, that was a big challenge and they needed to survive and they needed to get food. Having said these words, I just want to say a big thanks to NANGO for organizing this kind of platform where we share our experience during COVID-19. And my last few words is that COVID is real. Let us keep safe and practice all the regulations that are required by WHO. Thank you.